So good afternoon, everybody. Welcome back from lunch. I have actually a lot to cover, but I've tried to distill it to like 3 or 4 principles that I hope you can take back with you. My next slide is actually a slide I just added on topics I won't be covering because there's a lot to cover, and actually monitoring is a very interesting topic, but I'm going to keep it very actually to the nuts and bolts of monitoring. Quickly, before I start, does anybody want to define what they expect? What does monitoring mean to you? And so, I'm covering quality, coverage, and utility. And that's exactly what I'm going to cover. I'm not going to cover the whole, idea of what monitoring systems could look like. I'll give you a few glimpses. But since there's quite a varied audience, would somebody like to quickly kind of define what they would expect from a monitoring presentation? Anybody? Quality checks of data, okay. What about data use, right? Uh, Access to data. Anything else? Exactly. Basically, a continuous feedback loop so that you can iterate your program implementation. Anything else? Absolutely. Again, making sure that the data is used and then you change according to once you get that information. Um, so I think one thing that might be helpful is giving you a little bit of background on what we've been doing on monitoring before I kind of jump in. There are two big programs that ID Insight has been supporting. One is the Aspirational Districts program, and the other is POSHAN Abhiyan. Aspirational Districts program, we have been collecting data across 27 of the NITI districts every 4 months across indicators. So it's nutrition, sanitation, financial inclusion, agriculture, and more, from a panel of households. So, and I'll be talking a little bit about how we sampled and why that's important. We randomly sampled 1,000 households per district. So that means we're following 27,000 households every 4 months and giving information back to NITI Aayog on a range of indicators. And if you step back, why are we doing this? The hope is that it kind of feeds into a performance-based management system. So, like kind of pulling together all the elements that you're talking about, the hope is that, based on performance, people will respond at the, provider side particularly, and iterate to improve the, the delivery mechanisms. Of course, things don't work out as planned, and we can talk more about that because I'm sure you all have some experience in various, using various monitoring systems. But that's one example of monitoring kind of. It's not a system, but basically a mechanism that we are supporting. The other is for POSHAN Abhiyan. So for POSHAN Abhiyan, again, given that there is such a push, as you heard, and especially since 2018, to just like do a lot in the nutrition space, we were asked to kind of see.
Can you speak out of
the other one?
Oh, okay. Yeah, it's a little.
It's patchy, right?
Okay, it's patchy.
Yeah. So for POSHAN Abhiyan, given that there's been such a focus on POSHAN Abhiyan, and so many, like there's so much action. There's this whole discussion about the Jan Andolan happening. So the question that was put forward was, what is actually happening on the ground and what's reaching households? And so this, I just want to kind of highlight from my perspective, something for us to keep in mind is, getting a voice from the field. So a feedback again, and that's what a household survey can do, is what's actually reaching the beneficiaries. And so we did a large survey of, beneficiaries and citizens to see what are the services that are actually reaching them, and then we provided that information to the Ministry of Women and Child Development. So, there are these two large kind of mechanisms that we've been supporting. And so that gives you a flavor of some kinds of monitoring. And I'm going to be also covering much, like kind of zooming out in terms of what else is happening in the nutrition space in terms of monitoring. And I hope you will be critical and, you can ask questions on quality, incentives, utility, and all of these, because they're all big challenges that, we are also grappling with. So these are the questions I'm not going to be touching much on. One is that, Purnima did a great job in terms of talking about the evaluation part. But I just want to put out there that evaluation and monitoring are kind of related also, in the sense that, it goes a little to your real-time evaluation. So if you're providing real-time feedback in terms of what's happening on the ground, that could also be called monitoring, right? Because you're basically kind of responding to getting an understanding of how a program is being implemented. I will not talk much about results-based management. Theory of change we do touch upon, but it's quite complicated, as you saw from the slide that Purnima put up. We have a very simple theory of change, and hopefully it'll be useful to look at. And then also, I just want to put out there are a lot of new exciting technologies in terms of, for example, right now there's some experimentation going on in terms of measuring anthropometrics, like using an app to measure anthropometrics. Perhaps that could be a way forward in the future when we're talking about the fact that it's so difficult, to get actual measurement of a child. And I'm happy to hear, if you feel we're definitely not there right now, but there is a lot of work going on in these spaces on how to improve monitoring. I'll talk a little bit about some examples, but we don't have time to do too much. Okay. So I thought it would be useful to just kind of start with what is the reach of POSHAN Abhiyan. And it would be useful for us to think through each of these. Is who would if you want to answer this question, a policymaker comes to you and asks you this, who would the target group that you would look at to answer this question? So, given that we've heard a lot about POSHAN Abhiyan this morning, who's the focus group that, most programming is targeted towards? Perfect. And why? What data? For example, right now we're talking about reach. So what data would you be looking for if you're talking about, reach?
I think number of beneficiaries benefited out of any certain intervention. Reach, not benefited.
Yes, and also the interventions, right? Like the actual interventions. Have they received some of these interventions? Anyone else? So basically, in terms of the SBCC survey, and I'll talk more about it, is very often you also have to think of the denominator, right? So over here, especially if you're using government, data sources, it's often pregnant and lactating women who have been registered on these lists, these ASHA and Anganwadi lists. And you can imagine what the problem with that is, because you would be excluding certain populations who are not included on these lists, right? Those could be women who are using private services, but it could also be women who are, being excluded because of certain socioeconomic categories, etc. And what data am I looking for? You'd be looking at, the reach of various platforms, whether it's mass media, mid-media, interpersonal communication. And what time period would you be interested in if you want to look at the reach of POSHAN Abhiyan? Would you be looking at over the last 1 month? Would you be looking at over the last 1 week? Would you be looking at 3 months? Or since it started in 2019, what would be of interest? Okay. But remember that there's specific messages that go out during pregnancy, and also that these messages are for example, if you look at the first 1,000 days itself, preconception, it's about IFA, and ANC registration, and then after it kind of moves to institutional delivery, and then after that it keeps, evolving. So you want to kind of cover the entire range of messages over that woman's, 1,000 days. And the other issue, and I think Ari had mentioned this yesterday or day before, is recall, right? Like it's very hard for that. Let's say the woman has had a baby. Can she really remember whether she got a message 9 months ago? So it's this balance between, and that's when the monitoring, and that's what I want to kind of highlight in terms of monitoring, is you have to balance the recall issue in terms of accuracy, and then what you really want to, kind of get at. So what we did was we actually looked at soon after POSHAN Ma, because POSHAN Ma was this big push that happened in September. So we were looking at whether pregnant and lactating women actually remembered the messages soon after. And what geographies are you interested in? We looked at aspirational districts, urban and rural, but again, it's an important question in terms of, are you covering the urban women too, because they are a focus, though not enough. And then how is the data being collected and what is the quality? That's something I'll talk more about, but administrative data, there is a lot of administrative data. There is a Jan Andolan dashboard, which, it's at every district, where the suppliers, those who are actually, doing some of these community-based events, etc., are entering data, but the quality of that data is not very good, and we can talk about why. And so you kind of have to look at both household survey data and administrative data to kind of get a sense of. So this was what we came up with. I don't know if some of this would be kind of new to you, but I think it was a little bit of a revelation that the top 5 platforms from POSHAN Abhiyan, and this is a survey that we've just done, so these are brand new results, are basically related to interpersonal communication. And so VHS NDs, home visits, frontline workers, community-based events, and then television are the top 5 platforms. And so this gives you a sense of, okay, given the big push that's happening around POSHAN Abhiyan, what is actually, reaching these randomly selected pregnant and lactating women across the aspirational districts.
So
Which districts are these?
16 are the aspirational districts from.
Yeah, sorry. These are, the UP, Bihar. I can give them to you, but it's UP, Bihar, Madhya Pradesh, Rajasthan, Assam is included, and one more. So yeah, I can give you the list. We actually for this survey, we've done this 3 times now, so we can share data from 3 different rounds. For this survey, actually, we stuck to Hindi-speaking aspirational districts because there was a time crunch. Okay, so principles to keep in mind while you're developing a monitoring framework are, and going back, it needs to be accurate. It needs, and by accurate, I mean that it should be representative of the population of interest. So in this case, it was pregnant and lactating women, and it needs to be representative. It needs to be relevant. So, you need to select indicators that are closely linked to the programs that you're implementing. Timely, but also one thing to keep in mind when we're talking about monitoring, and there's a lot of discussion happening on this currently, is you want to make it light. You don't want to, put a lot of burden on frontline workers in many cases to enter large amounts of data that is not used. So it needs to be light and useful. You want to make sure that and this, we're kind of referring to a data culture where there's a kind of humility and respect for the system in the sense that you're hoping that the data is used across all levels. So, for example, if a frontline worker is actually entering the data, she has access to it and she can use it for her decision-making processes. And you hope that it's, it kind of then goes up and that people, that officials at higher levels can use the relevant indicators to get a sense of what's happening in a district. And Purnima has been talking about this, is there is, and I'll be touching on it, is what kinds of indicators are more useful at the frontline worker level and what's useful at the Niti Aayog level. There could be different kinds of indicators, and it's something that we are working on, and it's something to keep in mind. But I think it's important to keep in mind as a principle, light and useful monitoring systems are essential for them to work. Because otherwise it just becomes a reporting burden. People don't enter the right data. They don't, there's not enough buy-in on the data. So the steps for setting up a strong monitoring framework are, you have a theory of change, you select the metrics very carefully, you set up a data system, and then after that, the response codification is the use. Make sure that there is a system in place so that the data that is collected is actually, useful and used. So this is, going to be the main focus for a few minutes in terms of what are the key data sources for nutrition programming. And administrative data is one, and some of you must be familiar with the MIS systems. There's national surveys, and then there's third-party data. Administrative data, for example, the HMIS, ICDS, etc., is data that's collected by the service providers, and as they're providing the service, they enter in what service they're providing. National surveys are surveys that, like NFHS, where the data is collected. You go to a household, you collect the data from a household, and you get a sense of whether a household is getting the services that they're entitled to, like the one that I presented. And then the third-party survey is what we are doing, which is it's more kind of bespoke in the sense that it's kind of responding to a particular demand from government usually, where we're providing a sense of what's happening at the household level. The difference is in terms of national surveys and third-party surveys currently is of frequency, in the sense national surveys have not been very frequent till now. As you know, NFHS has been 5 years, though now there is some discussion about making these national surveys more regular. And that's important because if you want programming data, or, some information on programming, it is useful to have more regular, and quick turnaround data. So, in terms of the range of data, this is data that we collected on underweight children under 5 years. Basically, this was a comparison of self-reported, which is administrative data, with ID Insight data and NFHS4. And the point of this is just to show that, our data was quite similar to NFHS4, but the administrative data was really all over the place. And, I do have some discussions going forward on why, but if you want to take some guesses, I'm open to that. Go ahead.
Yes, notice that
most data sets that we've seen so far are just numbers. Can you comment on that?
That's a great observation. So you have error bars when you're sampling
From a population. So it gives you a sense of how confident you are of, whether your sample is representative of the population. So admin data does not have error bars because it's the universe, right? You're basically representing all the information that's there. Whereas NFHS should have error bars, and we just had this conversation yesterday. I'm not sure. I think my team didn't have access to the granular data. So I don't know, Purnima, do you have error bars on your NFHS data?
You can create the graphs.
Yeah, I think it.
I mean, we have data sheets which have all the conference intervals and
Yeah. So these are the three elements that are useful to keep in mind when you're talking about different data sources. One is coverage, the other is indicator definitions, and then quality of the processes by which data is collected. And, I think it's useful to just really going back, like leaving this monitoring session. One thing is just to keep in mind you want light and accurate reporting systems. And the other is these three elements is, what is the coverage of these various data sources, keeping in mind that there is a reason why some of these numbers might not match. There are legitimate reasons, and we're going to go into that. Indicators and definitions vary across these data sources, and quality also varies across these different data sources. So, just keep that in mind as once you leave, is these are three elements there are reasons why these three would vary across these different data sources. So when we talk about coverage, sample surveys basically, as most of you have probably covered over the last couple of days, is you select a random group of people using a variety of methods, and I can touch upon it if you want, to select a sample from a population that you want to represent. Admin data, as I mentioned, is data that's being collected by the providers. The difference across these two is in terms of coverage. Sample surveys would cover, everybody that falls within their sampling frame. Administrative data covers people who are actually accessing those services. And now it's interesting in terms of going into the indicators, right? Why would early breastfeeding vary for a sample survey versus an admin data? For example, NFHS covers children under 3 years. But when you're talking about early breastfeeding from administrative data, it's only children who are going to the hospital, right? Basically, it's measured at the hospital. Were they put to breast at an institution? So you're excluding a whole range of other women who are not there. Similarly, underweight, I think NFHS is obvious, but in terms of admin data, it covers children who are under 5 who are weighed by the Anganwadi, right? And that's something to keep in mind again, is there are a lot of women who, in fact, again, it's been, when you do process evaluations, it comes through that a lot of women are not actually, a lot of children are not being weighed to start with. So your denominator might be different. And actually, another point is the time period is much longer, right? NFHS is over a 5-year period, whereas admin data is monthly usually. And then geographic representation, that is obvious in the sense that each survey has different, units that it's representative of. So NFHS is representative at the district level, whereas admin data would be representative at the level that it's collected. So quickly, why are we harping on sampling frames? Does anybody want to talk about this? Do you know what a sampling frame is? No. Okay, I think this is actually quite useful to keep in mind as you. Since people are looking a little bit sleepy, can I ask all people who are enrolled in this course to please stand up? Stretch and relax. Okay, so my sampling frame right now was people who are enrolled in this course. The problem is there might be somebody in the bathroom right now who I'm missing from your course. There might be actually the cameraman who's also standing. So I've counted him now as my sampling frame. But my target was people who are enrolled in this course, right? In terms of the stretch and relax, that was more in terms of the indicator, right? Like I gave you one clear indicator was the stretch, and the unclear part was relax, right? Like from a monitoring system, I have no idea whether you're relaxed, right? So basically that kind of encapsulates the 3 points that I want to make is the target population, the sampling frame needs to be clear. And for me to get to the target population is very hard. Because, when I'm talking about the whole of India or the poorest districts in India, to find those pregnant and lactating women, all of them is difficult. And in this case, in one room, there might be some people who are outside. There's some people who are included by mistake. And so my denominator is something that I really need to be careful about. Please sit down. Thanks. So the target population is the population I want to capture, right? The pregnant women. The sampling frame is the women who I actually, then kind of I'm able to get, right? And the sample is the actual people that I go and interview. And so the challenge is to make sure that your sample is really representative of the target population, right? And remember I told you that we used ASHA and Anganwadi lists as our sampling frame. So what do you think might be the problem with having used ASHA and Anganwadi lists as my sampling frame? Exactly. They don't represent all the women that I want to collect. But why do you think we did use ASHA lists? What could some alternatives have been? Like, how do I go and find, all the pregnant and lactating women? Basically, you have to have this denominator, and then you have to randomly select from that denominator, right? So what are alternatives I could have used if I didn't use the ASHA list? Yeah, door-to-door is a great answer, but it's very expensive and, a lot of work. Primary healthcare centers, again, it'll be very particular types of women, right? Any other?
You can do ASHA plus institutional delivery, depending on the indicator you're looking at.
Right. So we did actually do a combination. So we did voter rolls, which is, India has a good system of, a large or the majority of adult Indians are actually enrolled on voter rolls. And so we use a dual frame of basically collecting information from voter rolls and ASHA lists. And we were also able to do some cross-validation, and 89% of women were on both. So that means that, it's not a bad system. And then we were able to weight, right? Like, so going back to what you're saying is combining the information and kind of weighting it to be able to represent the target population. And ASHA listed women, as you all mentioned, are slightly more literate, belong to SC/ST categories, and have higher self-reported income than those who we missed and who were on the voter rolls. So sampling approaches, there are lots of exciting new approaches that I won't touch on, but there is, satellite sampling, which is something that people are working on. The reason we're doing all these things is, one is you want to be representative of your target population. The other is it's very expensive to do many other, ways or methods to get at them. And so these are some of the ways that people think about. The one that you mentioned is the household listing. It's number 3. The problem with household listing is that it's not cost effective. Census would be great. We would love to use the census, but it's 10 years old right now. And we have used it, and it's, the villages have completely changed, and it's very difficult to find women based on the census. So we've used voter rolls, but the reason why I've gone into so much detail on both sampling frames and all that is just to kind of highlight that when you're thinking about monitoring systems, it's important to think of your target population, and is your monitoring system representing that target population accurately? Now I'll just go a little bit into this, basically the kinds of indicators, and this refers a little bit to the theory of change. So they're the inputs, activities, outputs, and outcomes, right? Somebody I think you were talking about vacancies and staffing and, those problems. So that would be the inputs, right? And for sure, it's something to keep in mind, because unless you have those inputs, it's almost impossible to reach the outcomes or the outputs. So the theory of change basically kind of breaks or sets this chain up of what are the inputs, activities, and outcomes, and gets you thinking about, okay, if there is a break right up at the input level, then, it's not plausible to expect outcomes. And, like we've had these discussions on focusing on outcomes and stunting and all of that. And, those are way down the line. You need to first get a lot of these other pieces in place before you can move to, further down. And in terms of data, it's useful to think of administrative data as providing information on the inputs and activities, right? And for survey data, to kind of complement it, it can provide some process level information, but then it also provides information on outcomes. And that is something that you don't need so regularly, whereas, the activities and inputs is something you need much more regularly. So, this is the way that we are thinking about it currently, and again, it goes a little bit to the reporting burden, right? In the sense that you want to not have the ASHA or Anganwadi worker measuring all these outcomes and at that level, and leave it to a household survey to do it at a particular time, whether it's NFHS or other third parties. So this is an example for complementary feeding. One other takeaway from this is actually kind of reflecting. Over here, we've represented 5 data sources, and basically, Purnima's team, I think, had kind of mapped out all the different data sources in nutrition. And I think just at the national level, there are some 19 dashboards. So, again, talking about monitoring, it's important to kind of think about streamlining efforts, making sure that people are not replicating or collecting the same data for different dashboards in some cases. And what this is doing is thinking of, for complementary feeding, you need first the inputs, which is the ASHA, staff around. You need training. Activities you want to make sure that they are, going to, for home visits, providing community-based events and BHSNDs. Outputs is that the women actually have received the counseling, right? That has been planned. And the outcomes are change in behavior. So they actually are providing the food that, at the right time, etc. But going back to, again, conversations that have been had, it's very difficult to measure some of these. In terms of outcomes, these are relatively simple indicators in this dashboard, but there's a whole lot more in terms of when you're talking about complementary feeding is, the care with which it's given, the nutrient content that was discussed in the first sessions. And all that is not going to come in here, but it's, elements to keep in mind as you're thinking of basically frameworks in terms of understanding what's the status of programming in the country. So finally, in terms of data quality, the 3 elements that I think are important to keep in mind are, the capacity and the skills of the people who are entering the data, the incentive structures, and then, the respondent surveyor bias. All this kind of ties in with data culture, right? Basically, people, the frontline providers and the citizens of the country will be more open in sharing information if they feel the data is being used, if they feel that, the data is kind of going to improve the lives, the provider and the consumers' lives. And so this is something that, again, it's useful to, keep in mind in terms of why are you collecting the data, making sure that, for number one, that the staff are not overburdened, they're collecting the right kinds of indicators, going back to the theory of change that I mentioned, they're collecting just, inputs and activities, they're not being forced to collect a whole range of other things that they're not actually able to kind of push at that level. And then after that, you have to make sure that there's some systems in place to prevent errors and that there's training, etc., on top of all the other work that they're doing. In terms of incentive structures, I'm assuming some of you have come across this, is that if you are entering the data about what you have provided, there is a incentive misalignment there in terms of, over-reporting. And, that is something that needs to be thought about. And so one way could be just kind of letting the provider know that there will be some kind of an audit sometimes. The better way is also to kind of let them know that it's okay if you're reporting, poor outcomes, you'll be provided some kind of support, and they won't be punished for reporting, that they've not been able to achieve certain milestones. And that goes a little bit to what I had initially alluded to, is this whole results-based management. It needs to go with the proper kind of supportive supervision and hand-holding, etc., to make sure that incentives are aligned. So you get good quality information that you can use to iterate and improve. And finally, in terms of respondent survey bias, I think it's been covered quite a bit already. Social desirability bias. Currently in India, where there is such a push, everybody's talking about POSHAN Abhiyan, Swachh Bharat, etc. You do have to be careful in terms of the way you frame questions to households, and make sure that they don't feel that they have to, that they cannot say that they're not getting a particular service. Sorry. So I'm almost done. Sorry. So in terms of data quality, it's important to just keep in mind that there are certain systems in place when you're collecting data, and basically at the beginning you want to prevent misunderstanding of survey questions, falsification of responses. Sorry, I'm losing my voice. Sorry about that. As I was saying, there are various points at which you need to make sure, if you're setting up a system, these are the steps to set up, but more importantly, even as consumers of data, you should ask these questions in terms of, what are the data quality systems that are in place for survey admin data to make sure that the information you're getting is accurate. So, for example, at each stage, in terms of pre-survey, you want to make sure that people are being, the right kind of people are being hired and trained to collect the data. In terms of during the survey, there are good data quality checks in terms of, spot checks, data checks. And then what we do is, as we're collecting the data, we also kind of keep improving the system. So if there's a particular question that we feel people are not understanding, then we can actually go back in real time, tell the surveyor to change the question, change the protocol, and improve the quality of data. So these are systems that actually, unfortunately, are not done even by the best surveyors currently. And it's something that we hope that we can push the needle on in terms of making sure that survey data is, of better quality. And then after that, you can also correct the data once it's collected. So, we have audio audits. So a random sample of questions is actually recorded. And then we can listen to, did the person ask the question right? Did they record it right? And then we can go back and, correct these questions. So basically making sure that there are these systems in place that make sure that, the quality is reliable. Finally, in terms of social desirability bias, these were some examples from everywhere, but useful to hear from you, given the pressure currently, in terms of POSHAN Abhiyan, what are the questions that you think, or the topics that you think people might over or underreport on in terms of social desirability? Breastfeeding, for example, is one that I can think of, where there's so much pressure, perhaps, there's so much advertising going on in terms of exclusive breastfeeding. It is possible that, respondents misreport. What are the other ones that you can think of? And
What they're doing with
girl child.
Sanitation is the big one, yes.
Cash transfers.
So how would they misreport that they didn't get it but they got it?
So I recently read about this where there was a study that said that people underreport on whether they've received cash or not, because if they say probably no, they think they may get it again.
Mm-hmm. We actually heard that for Swachh Bharat also. That's what they're saying, is that people underreported because they thought they'd get more. But yeah, I would take that with a grain of salt. Any other examples?
Age of marriage.
Age of marriage, yes. Income is a big one. People really don't like reporting their income, and actually, interestingly, in this case, higher SCS people report even, like, there's more bias. Okay, so my key takeaways are, sampling frames, indicator definitions, data quality systems are important to keep in mind when you're talking about monitoring. And, you should be a sophisticated consumer and producer of data as you get it, and ask these questions when you get it, so that people are on their toes in terms of producing high quality data for you if you are not producing it yourself. And monitoring systems, as I said, it really gives a voice to thank you. It gives a voice to households in many ways, and to beneficiaries at these various service points, and it's something that we should value and use to inform our programming and decision making. Thanks. Questions? I just got a clue.
So can you go to slide number 10? So earlier on we were discussing, Purnima ma'am, about the government system reported data and that which is being, found, that which is identified in national surveys and third parties. So very interesting to know that here self-reported data is in one district higher than that of national surveys. So I wanted to know, self-reported here means CAS data or MPR data? Which data are we talking about when we say self-reporting?
Yeah, this was HMIS.
HMIS data.
Yes. Mm-hmm.
So now I had this, the thought or question, I don't know what to call it. So we have this government system data which is coming every month. A lot of data is coming. And we obviously know there are, a lot of challenges and problems with it. So by knowing that, we tend to, reject most of the government data. However, within that data, there is a quality data coming in. Now, how do we, separate this good data from bad data within government system data? Because it is something which we get every month, and we can truly make use of it to take, some quality decisions. So how do we, first of all, check or differentiate between good government data, bad government data, and what are your thoughts about it?
Yeah, I think it's a great question, and it's something that I really hope we, and that's why we're talking about incentive structures and things like that, because one is making sure that people, the government system is set up in a way that can produce good quality data is, step one. Step two is, okay, you're saying maybe there are actually some systems that are fine, but you're not able to use them because there's this kind of cynicism sometimes about the data itself. And we've actually, there are three ways that you could look at it. One is comparing that data with any other data and showing that actually it's any other data being, for example, NFHS. Right, and saying that, okay, these numbers are kind of similar, so we can triangulate it and we trust it. The other is, just in terms of sense checks, looking at time trends. Are these trends making sense? Comparing with other, neighbors, etc. Basically, is it making sense, and is it how can you use it? Because another mantra is data use improves data quality. So, it's almost like once you start using it and once you go back to an official kind of, like at a particular level and say that this data is something that I'm going to be using to make decisions, as compared to currently a lot of data, as you're saying, is just collected and not used. So the incentive for the person who's using it is low to make sure that the quality is good. So if they know that there is somebody up there who's actually going to make some decisions, call a meeting based on that data, there have been improvements in data use.
So we have been, collecting now caste data for 3 months in Maharashtra, and you'd be very surprised to know that it's very, relatable to NFHS or sort of that. So much so that, government has to at state level issue a resolution कि MPR and caste का इतना सारा difference आ रहा है, and these are same people filling in. Because if you there is a subtle difference between caste data because the classification of malnutrition is done by the software, and you have to only enter the anthropometry, and our sevikas are not so much intelligent today to fill. So but yeah, so
No, I think we all feel that admin data should be used more and more, and data should be used for decision making, right? Like that's the goal of a lot of this course, is that you want to use data for decision making, and hopefully you can use administrative data. Currently, in many places, it's not ready, but where it is, that's great, and
because we don't see much efforts being put in that direction. As far as data-driven decision support system goes, we only have third-party data which is being used. And the reason often quoted is that government data is bad data. And then coming back to your argument, unless we use the government data, the quality does not improve. So it's a cycle, and I don't really have any example to look forward to that how government data was being used and then the quality was improved, then problems are identified and again worked upon.
Yeah, Purnima.
I think there is an example from UP where I think the Gates UPTSU has been working with the UP government to bring out the HMIS data, and they've brought it into a portal, and there's some things that so what they're doing is basically visualizing the data that's there, but they're also pulling into it some elements that help them start the conversations around data quality, right? I think both from, I think the session that I led on evaluation and the session that Divya's led here on data, what's important is that people understand the differences between the different sources of data and then think hard about use. Just like I said, there's many different evaluations you can do, there's many different ways of doing evaluations, but it should speak to a need. And it's the same thing in a sense with looking at data. It should speak to a need, right? And the work that we've been doing together to try and sort of put together this data landscape from India and start this, hopefully we hope to start, I think it'll be a conversation on what data do you use for what kinds of things, right? So to me, NFHS data is very useful for strategy, right? So because you get it at periodic times, you can basically, what all of you have been doing here on diagnostic, it's useful for diagnostic work in a geographic context. It's useful to say, okay, I can look at the coverage targets in NFHS, and then I need to increase those coverage targets. But you need to then go back to your monitoring data on a quarterly basis or an annual basis or whatever else to say, okay, how can I now use that to actually look at whether coverage is going up, right? So there is a tendency when people like the results of one data set, you use an indicator from another, but that's not really the purpose, right? I mean, we have to get to use at the end of the day, and we don't have the results yet, but we're with a collection of a few other researchers. Our teams are doing studies on how data is currently used in admin systems.
Yeah,
And
basically,
what the culture is.
Yeah, what we found is that and that's why I was harping so much on this, is, it's used as a reporting tool, right? It's basically kind of pushed up, and so it's this incentive problem, is that it's great. People we spoke to found it great when a district magistrate actually used the data and made some decisions based on the data. The entire system felt that, okay, they're focusing on this issue. But on the other hand, there's a lot of data that is just not used. And so in general, people who are collecting this data just, like entering this data with the sense that ye kabhi use nahi hoga. So the sense of pride or of importance of data is not that high. And this was in Chhattisgarh, in UP, and in Bihar. So not Maharashtra, likely it's different. And that was something that we have talked about. It might be good for us to go to some good data use case cases to kind of get a sense of what's the best practice or best case. And there's variation within these states also. You know, it really is quite idiosyncratic in the sense that it depends on individuals showing interest and, you know, it really is a culture issue. And so culture is defined by the norms and leadership that's there.
I think you said something very interesting. So you said in Maharashtra, a lot of the CAS, what's coming out in the CAS is matching or closer to what you would see in the NFHS, right? Now that would happen if you're in districts where the universe of people is being captured in CAS. So for example, if in some states, or in some districts, if you have only 20% of kids coming into CAS, and if they're the poorest of the poor families who are using, because, you know, it's whoever the ICDS users are, you may be less likely to see a match with the NFHS. So I think that's a good, you know, it's useful to keep in mind that, okay, it's interesting when it matches, but just because it doesn't match does not mean that one data source is worse than the other. They are different, that's all. And they're different for the reasons here. They're different because of the sampling, they're different because of who asked the
indicators are different, recall periods are different, denominators are different. So, I mean, I hope you go away with that also, is that in many cases the data points would be different. And for a legitimate reason is, you know, all these things, denominators, recall periods, indicators, the way questions are asked. And so that's also something to, you know, when you get pushback, it's something to think through.
I would like to ask something. So this is basically you saying that it depends on the sample frame and the method of sample and all these things. But what about budget data? So if I talk about NHM data, prior to 2014, when the budget was flowing through the treasury, bypassing the treasury, state treasury, then we did not get any data from state budget report, and we used to look at MIS data. But since 2014, we are getting NHM data in state budget also. But these two data do not match. There are discrepancies. And it does not depend on any sampling framework or any methodology or anything. So how do you, I would like to hear your comment on that.
Interesting. I mean, I can give the response that this is a nutrition survey. Yeah, the underlying factors. But, you know, in terms of, you're talking about state, is it the same questions, the same, you know, going back to are they the same indicators? Because, if, for example, if you're comparing, you know, consumption data versus, like, you know, is it from the household or is it from the provider?
I'm looking at budget data.
Yeah.
State
so
budget
there might be
data.
certain, you know, items that are not included in both. I'm not sure.
That can't happen because the budget data has to have all the components included in the state budget document, and it is given in the MIS report as well.
Yeah, it's interesting because one thing that we generally, like a rule of thumb is money data is often more accurate. So it's interesting that you're finding it not so, because, you know, for example, JSY, etc., you know, that data is generally, you can trace it better. And so it's kind of disappointing in that in your case it's not, and I'm happy to like look more closely to understand what the problem is. I haven't seen it.
We showed the reach of POSHAN Abhiyan, wherein you did surveying and you looked into 16 aspirational districts. So, are you using some kind of monitoring measures to, in addition to the survey, is there any other monitoring tool that you are using to address the coverage or intervention? the
Yeah,
reach
so-
of intervention.
So this actually, I would call it more like a triangulation exercise, because there is the Jan Andolan dashboard, and the Jan Andolan dashboard is supposed to be used for the regular monitoring. Ours is, again, the Jan Andolan is supply side. This is from the household side. So what is actually reaching the mother who's, pregnant and lactating women are actually less reachable in many ways, right? Like they are in their homes, they don't go out that much, etc. And so this is a question, this is from the demand side, right? So after having made this push on the supply side and maybe measuring it correctly, on the demand side, are these mothers actually being reached by which platforms? And then we have a whole lot more information on, what are the messages they remember, what are their what is the knowledge. We actually tested them on certain, knowledge questions, and then practices also. So I'm just sharing like one slide. It's a big study. Yeah.
About data. So regarding data from the NFHS mainly. So for health economics, basically we rely, we look forward for a lot of data from the Indian context, wherein
It's absolutely missing. So we always bank upon data like for probability data. Like for example, when models are created for to
simulate a disease condition or whatever, be it in nutrition or be it in any other disease per se, we try to incorporate values, probability values from whatever is available from the Indian context. That is what is being sought for. But the point is that we hardly come across any data from the Indian scenario. So for NFHS mainly, when we were talking about NFHS, we had used the, we were doing this health economic modeling for introduction of subdermal implant into the Indian healthcare system, in public healthcare system. So there we wanted probabilities of people who were shifting from the use of one type of contraception to another type of contraception. So we followed a cohort of people for 1 year and saw how they shifted from one, looked into. So we did in fact the primary analysis from the NFHS data, which was in fact a blessing in disguise. Otherwise, there was no data available. So for any of health economic studies, we do require data from the Indian context, which is absolutely missing, be it in nutrition, be it in anything. So it would be great if some energy is focused into that direction
Yeah, I would say there's a lot of discussion happening on this, right? And I do think in the future there will be more data, and I think institutions like yours are great to kind of push that agenda and make sure that the quality and use, etc., is also happening. But do you have specific examples, Purnima?
No, I think you can always have more data, but in my view, we have to have sort of a good clarity on what is the
What
data
is
we
required.
need for what purposes, right? Like I'm saying, to me, NFHS data is very valuable for research, for just looking at broad trends at critical periods, and it's useful for strategy development. And what we've really, I love the fact that there is now district level data that at least gives you some things. It doesn't give you everything, right? I mean, you don't have district level low birth weight data, you don't have, in fact, a lot of infant and young child feeding, you won't get district level data because the sample sizes are too small, but at least it gives you enough that you can start to move in a certain direction, and then if people still perceive needs, they need to think about how to get those. It is not good, I wouldn't use it for program monitoring, right? So the data for the purposes is what we should really be looking at. There are huge data gaps around nutrition in terms of food consumption, actually.
And I mean, having a strong civil registration system is also a start, right? And that's something that is missing. So it's very basic requirements.
One of the challenges that we've talked about in the monitoring framework work we've done is that for some of the POSHAN Abhiyan interventions, you will get data from 6 different sources.
Mm-hmm.
That will require a lot of sense making. And then there are other aspects or other interventions in POSHAN Abhiyan for which there is no data available right now. So, for example, none of the monitoring systems capture what's going on with preconception or with adolescence. I'm sure there's at least a few others that
exactly.
we've missed. And so, what we also
NCD.
feel, NCDs,
Yeah.
there's very little data on some things. So it's, just having people who thoughtfully try and work through, okay, what is the data we may need for what kinds of purposes is useful. And sometimes those data gaps can be closed at the local level. If somebody really feels they need something, if you're in a district that has a very high burden of NCDs and you have no data on that, then those are things that, maybe, or if you have no data on people's, on the risk factors that we know, right? You have no data on physical activity, on people's lifestyle diseases, on, other risk factors for NCDs. How do you know where to start on your strategy? Then you just have to go with your best guesses and then start to close your gaps. Yeah.
Okay. No, one of the reason Kerala has a very good coverage in service delivery, I think largely because of the local self-government system is very strong in Kerala, and the purpose of collecting data, if it is for planning at the local level, what needs to be done, where things are going wrong and what needs to be done, and then the purpose of data collection also changes. It is not for reporting purpose, it is for planning at the local level, and I think that needs to be given more focus in our monitoring thing, and that I think that is where we are lacking.
That's a great note to end on. Exactly, in terms of making sure that that the data is used at the local level, right? And I hope I've said that enough times, that it really needs to be used from from the data collection point onwards.
And then the data quality also
Improves then, exactly. Thanks. Yes.